Dr. Karen Vanoy, like these doctors, I mean, how many of you guys would like to do this every month? I'd like to do this every month because I love the wisdom that we're learning from all of these amazing health professionals today.
So our next doctor, Dr. Karen Vanoy, 29 years experience as a doctor of optometry. I love the diverse, practice that we have here as well in the medical profession. So, Dr. Karen, welcome. Welcome to this event. Thank you so much for being such a big part of it. We're going to kick things off with you right away with a question, okay? So photobiomodulation. We've heard that, David Schmidt's mentioned that in some of his talks and podcasts. How does photobiomodulation connect to health relating the eyes and eye health?
Well, what is it? What is photobiomodulation?
So it's a wonderful term. Photobiomodulation involves using specific wavelengths of light to stimulate cellular processes, particularly in the mitochondria. And I think Rachel said that earlier about how important the mitochondria are. They are the powerhouse of our cell. And so the eye is one of the most light responsive organs in the body, and the retina is densely packed with mitochondria, making it a naturally receptive to the photobiomodulation signaling. And X39 is using your body's own emitted infrared heat and reflecting that back through that magical crystal lattice there at a specific wavelength in order to cause that photobiomodulation that's enhancing our mitochondria in our bodies.
Wow, that was a great answer. I just know that seemingly in my experience, my eyes have gotten better. And so that may not be for everybody because we don't treat, cure, prevent, or heal any diseases. But in my experience, it happened to me, it happened to my mom, it happened to Scott. So lots of great stories we get to hear every single day, Dr. Karen, with eyes and teeth. So we love that you're here talking about this. And so when we're talking about the GHK copper peptide, the copper peptide that's being activated by X39, what specifically is important about that, like with the aging process and with our eyes?
So GHK-Cu is a naturally occurring tripeptide, a copper complex found in human plasma, and we see its levels measurably decline as we're aging. So that GHK-Cu, it acts as a master regulator of gene expression. It's turning on genes involved in tissue repair, antioxidant defense, collagen synthesis that Dr. Prasant mentioned, and cellular communication. So specifically for the eye, the GHK-Cu's antioxidant actions are super relevant because they're helping with decreasing oxidative stress. And that is a central driver in the mechanisms for cataracts, age-related macular degeneration, and glaucoma. So as that GHK is upregulated in the body, you're upregulating the antioxidant network that is helping to reduce the reactive oxygen species that are causing the aging of our body. And so it's an amazing mechanism that we're seeing with GHK. It's a natural thing. We are supposed to have it, but as we're aging, we're seeing it decrease precipitously. And so that antioxidant network, I know I've heard David Schmidt mention superoxide dismutase, catalase, glutathione, which is super important in the eye. And all of those antioxidants are upregulated by wearing the X39 patch. And so as that process is happening, we know X39 has been associated with about a 30% increase in glutathione production through that pathway. So that's an amazing part of how it affects the eye, especially for glutathione, because glutathione exists in an unusually high concentration in the lens of the eye. So higher than almost any other tissue in the body. And because what its function is in the lens is its primary defense against oxidative damage. And so it neutralizes the free radicals that would otherwise cloud the lens proteins and initiate cataract formation. So the glutathione, which is enhanced by GHK-Cu, is helping the nucleus to not age as quickly. And so those levels of glutathione in the nucleus decline with age, and that decline is very directly correlated with the onset of age-related cataracts. So when we think about GHK-Cu elevation through X39, we're helping to restore a youthful glutathione level And that's directly addressing one of the most well-established root causes for both lens and retinal deterioration.
Yeah.
So,
I mean, I'm thinking about cataracts, and I'm thinking about how many elderly people, they just line them up for those cataract surgeries, right? And so what if there was a way that we could increase, like you said, this natural glutathione, and, seemingly the eyes would help to,
exactly.
possibly improve, right?
Mhm.
So it's very exciting to think about. Are you just telling all your patients about this? Because your knowledge base of what you're talking about here with the eyes is amazing when I'm listening to you. So I can imagine when you have a tool as simple as this little patch that you are wanting to talk to a lot of your friends, family
Absolutely.
members, and patients about it.
Well, I love, what Dr. Present said a minute ago about corporate, corporate practice. And that is a big issue right now. I was in private practice for myself where I would have had the latitude to, share this a lot. Now it really is more limited. If patients ask me questions about that, then I can discuss that. And so friends of mine, for sure, if they're friends and patients, then that's great. But for me, this is just, we are definitely limited by corporate setups for what we're allowed to do and how we're allowed to proceed with things. And I definitely would not want to do anything unethical for my company or anything like that. So I have to very much balance how I present things. But for myself, I mean, I'm sharing it with as many friends and family. And the way I was introduced into this technology was actually a patient of mine. She came into my practice and she was saying, well, Karen, I am not needing my distance contact lens anymore because I'm seeing better without it. And so she said, I'm wearing this phototherapy patch, didn't share the technology with me at the moment. And so I typed in her chart, she's wearing this phototherapy patch. And in my mind, I'm thinking, bless her heart, she thinks this is helping her vision. But a few months later, when I ran into her out in just the regular, day-to-day life, because we were friends, she was seeing better as well for her near vision. So her vision continues to improve. I actually, with her permission, not violating any HIPAA laws, she has improved again, and her vision is still continuing to improve. So that's how I was introduced to the technology in the first place, was actually a patient that was seeing better because of what had happened to them personally. So that made me go into the deep dive to figure out, well, how is this even possible? And because initially, as I was not trained to think about, your body healing itself or what's involved in that. We just accept decline as a natural part of what happens to our bodies. And it is, because none of us are going to live forever. That's just not the way this works. That's not the way God created this setup. But it's amazing to see how we can live well and live better lives by allowing our body to have what it needs to actually function at a much higher level, because of the fact that we live in such a toxic environment and everything is an insult against us, from the food we eat and the exposures that we're seeing in our environment. We want to do everything we can to live well, because I want to live a long time, but I don't want to live a long time if I'm in poor health and not having good quality of life. So I think that's for most people.
Wow.
Yeah, Dr. Karen, I got to admit, one of the common themes that we have, you're a fourth speaker on this panel, is kind of this humbleness, to take a look at something, especially in your case, taking a look at, something from your patient, who you're the expert and they're the patient, but they saw some results and you must have established a relationship where they could be open with you. And so that speaks to, who you are as well. But, as a professional in the medical community, having that humbleness, having strong integrity, having ethics, and finding a way to still follow, of course, all the guidelines of your profession, but sharing it with people on a personal level or family, you found a way to do that. Another thing that I heard you mention that I want to make sure that people didn't miss, and this really goes along with, this is a team and Steve Agina Merritt talking about the X39 patch and being really kind of laser focused on that one individual patch. I heard you say, glutathione production from your experience is being elevated. Of course, LifeWave has a glutathione patch, right? But our patents prove that the X39 can elevate GHK-Cu copper peptides. And what I heard you say is then that peptide is supporting and elevating the glutathione, that antioxidant that is so instrumental to eye health, right? So we can be confident in staying kind of singular and focused on that one patch. What do you think?
Absolutely. I mean, I think the main thing with this technology is that X39 has become the flagship. It is what David Schmidt probably saw multiple things in multiple patches that he could include all in one by elevating the GHK-Cu, because GHK-Cu is such a master at doing what it does. So again, as people get involved with the company, there's no way we're not going to wear other patches. But as far as just getting people started, don't make it so hard. X39 is so wonderful at doing what it's supposed to do. And again, glutathione restoration is one of the most important mechanisms for vision improvements, because glutathione restoration, the lens itself depends on glutathione more than any tissue, almost any tissue in the body, for maintaining its optical transparency. So boosting the glutathione through GHK-Cu upregulation, that is how X39 supports the body's own antioxidant structure. And that includes not just the lens, but in the retina, because the retina is the photoreceptors and the retinal pigment epithelial cells. Those are all involved in our vision, and we need those cells to be functioning at optimal levels. And so glutathione is helping, and GHK-Cu is helping to produce that increase in glutathione production.
Wow.
It's amazing.
So if you ever wanted to know what mechanism, why are my eyes seemingly improving? She just told you, right?
Yeah.
Because we've had it. When he started, he had some floater thingies, and he noticed after wearing the patch for probably 6 weeks, he's like, not seeing all that stuff on the eyes anymore.
Right.
Like I said, we've saw really amazing results with my mom, with her eyes. Her doctor was quite astounded, actually. So we love that. We like to shock our doctors, right, guys? And so when they see those results, they're like, okay, I better take a look at what you're telling me. So we do appreciate your humility.
People ask me,
Oh,
I've only been patching for 10 months. And so my eyes may still improve as I'm going. I'm 55 years old, so I still need help with reading. But the problem is also not everyone ages at the same rate. So people are not going to respond at the same rate. I don't see people getting cataracts at exactly the same age in my practice. I have people in their 40s getting cataracts. I have people like my dad, who was in his 80s before he needed cataract surgery. So we all age differently. So we all respond differently. And that's important for us to note, that no one is going to respond exactly like another person with this technology, because our body is in control of what needs to be fixed first. Again, the stem cells know where they're supposed to go once that happens. And the priorities that we will see with the stem cell reactivation, our body's in control of where those go first.
I love it. And that's why we tell people we can't confirm your exact results that you're going to have, but let me know what changes, because we know it's going to be positive, right? So we say that a lot, because there's like, what's it going to do for me? Well, we can't make any medical claims, but you tell me what happens, because it's going to be big. So Dr. Karen, you're a blessing. Thank you so much for all of your wisdom today. Wow.